హాయ్ ఫ్రెండ్స్, హలో, గుడ్ మార్నింగ్ ఫ్రెండ్స్. ఎలా ఉన్నారు? ఐ హోప్ అందరూ బాగున్నారని అనుకుంటున్నాను. వెల్కమ్ టు మై ఛానల్ ద వాయిస్ ఆఫ్ నర్స్. Today we are going to discuss a new subject. The subject name is Midwifery and Gynecological Nursing. In this subject, Midwifery and Gynecological Nursing subject point of view, we will discuss continuous questions, frequently asked questions and very important questions. This is not first subject. Already in previous video we already finished 100 questions in anatomy and physiology and also nutrition point of view. We already discussed in previous years questions and very important questions also. And not only anatomy and physiology, we already discussed in the nutrition point of view also 100 questions. Not only anatomy and physiology, and we already discussed NHM 2022 2 sets and NHM 2023 1 set, recent January paper also, question paper 100 question we already discussed. Just click it once friends. Next we will discuss midwifery and gynecological nursing. Very important questions and answers. Before moving on to topic, a small request friends, those who are watching my video, ఎవరైతే నా ఛానల్ని ఫస్ట్ టైం చూస్తున్నారో ప్లీజ్ సబ్స్క్రైబ్ మై ఛానల్, క్లిక్ ఆన్ ది బెల్ ఐకాన్ ఫర్ ఫర్దర్ నోటిఫికేషన్, గివ్ ఏ లైక్. మీరు లైక్ చేస్తే, మీరు చూస్తున్న వ్యూవర్స్ కనీసం మాకు లైక్ చేస్తే నా వీడియో ఎవరికైనా యూజ్ అవుతుందో లేదో అనేది నాకు తెలుస్తుంది. నెక్స్ట్ నేను ఇంకా ఇంప్రూవ్ చేసుకోవడానికి కానీ నెక్స్ట్ ఫర్దర్ వీడియోస్ చేయడానికి కానీ నాకు బూస్ట్ ఇచ్చినట్టు అవుతుంది. ప్లీజ్ సపోర్ట్ మీ ఫ్రెండ్స్. లెట్స్ మూవ్ ఆన్ టు టాపిక్. ది ఫస్ట్ క్వశ్చన్, ఎట్ ది టర్మ్ approximately placenta weight is. At the term, how much the placenta weight is approximately? In following the options, we will see the options first here. Option A 1700 grams, option B 1200 grams, option C 500 grams and option D 700 grams. The ability of the fetus to grow and thrive in utero depends on the placental function and also the average weight of the placenta at term 508 grams. Not exactly, approximate here. Option C 500 grams is the correct answer, but the average weight of the placenta at term is 508 grams. Here we will discuss not only placental weight, we will discuss additional point also. The ratio between placenta weight and the birth weight of the newborn is 1:6 and size of the placenta is 10 inches long and 1 inch thick at its center, the point of view. So here at term approximately placenta weight is option C 500 grams. Next move on to question number 2. What is the full form of HELLP syndrome? What is the full form of HELLP syndrome? We will see the options here. Option A hemolysis, elevated liver enzymes and low platelet count. Option B hemolysis, elevated lipase enzymes and low platelet count. Option C hemoglobinuria, elevated lipase enzymes, low platelet count. Option D hemolysis, elevated lymphocytes and low platelet count. Here HELP, HELLP syndrome, rare pregnancy complication. HELLP syndrome is a rare pregnancy complication. HELLP syndrome usually develops before the 37th week of pregnancy. It is a type of preeclampsia, causes elevated liver enzyme and low platelet count. So here option A is the correct answer. Hemolysis, elevated liver enzymes and low platelet count. Option A is the correct answer. We can see here in this picture helpful HELLP syndrome treatments. In these cases patient may develop anemia and also some cases seizures also they will develop. Here we can treat like blood transfusion, treat for anemia and bed rest. Continuous monitoring to be done a pregnant woman and also fetus. Next, the magnesium sulfate for the correction of the seizures to prevent the seizures. And blood pressure, in these cases patient will develop hypertension means preeclampsia. In cases we can give medications and corticosteroids for fetal lung development. Okay friends, here the HELLP syndrome. HELLP syndrome is one of the life threatening complication during the pregnancy. Here we can see HELLP. Option A, hemolysis, elevated liver enzymes and low platelet count. Option A is the correct answer. Next we will discuss question number. Fertilization of two ova released in different menstrual cycle is known as. Okay friends, in fertilization the two ovums is released at different menstrual cycles. Means the two ova is released in different menstrual cycles. This is called as in medical term. We will see the options here. Option A, superfecundation. Option B, superfetation. Option C, fetus papyroseous. Option D, none of the above. Here the fertilization of the two ova released different menstrual cycle is superfetation. Option B is the correct answer, but we have to know what is the superfecundation and fetus pericaceous. We will discuss now what is superfecundation. Superfecundation means in these cases body releases two or more eggs during the same time of menstrual cycle. This is different. Okay. Option B, superfetation. Superfetation means it is a rare event that involves getting pregnant woman and a second time while already pregnant. Next, superfetation, two embryos that form during two separate menstrual cycle. This is the easiest definition for the superfetation. Superfetation means two embryos that form during two separate menstrual cycles, and less than 10 cases we can see the superfetation. Next, what is fetus papyrios? Papyrios means flattened remains of the one twin fetus which has died in the uterus and been compressed by the growth of the other. It is the option C, fetus papyrosis is 1 in 1200 pregnant cases. Here we can see in this picture the fertilization of ova released different menstrual cycle. Means the fetus is first 38 weeks fetus, then 34 weeks. Difference between the two fetus is 4 weeks difference. We can see in this picture. This is not clear na. I will show you in bigger. Here we can see here 38 weeks fetus at 38 weeks. First, second one is fetus at 34 weeks. This is called as superfetation. Next we will see the question number 4. Largest cell in human body in females. Okay friends, largest cell in human body. We will see the options here. Option A, ovum. Option B, osteocytes. Option C, Gallial cell. And option D, myelin cells. The largest cell in human body, especially in females. Option A is the correct answer. Largest cell in human body in females, egg. It is called as in medical term ovum. It is a single cell released from ovary every month. The size of each ovum is 0.1 mm in diameter. Okay friends, the largest cell in female is ovary. This is released from ovary every month of menstrual cycle. Not only largest cell in female, here we will discuss the smallest cell in human body. In males, here largest cell in female. Next we will discuss in this question. Additionally, smallest cell in human body in males is sperm, 4 mm in diameter. The sperm is 20 times smaller than the ovum. Okay friends, the sperm is 20 times smaller than the ovum. So here largest cell means ovum, smallest cell means sperm. Here we can see the largest cell in human body, the ovary. This is the ovary, the largest cell in human body in females. Next, move on to question number 5. What is duration of puerperium? Puerperium means after the pregnant lady will get after birth, the period is called as puerperium. Puerperium duration, how much? Options: option A 10 weeks, option B 1 month, option C 6 weeks, and option D 28 weeks. The period of puerperium is about 6 weeks after childbirth is called as puerperium. During this period, which the mother's reproductive organs return to their virginal non-pregnant condition. Here, the puerperium duration is 6 weeks. Option C is the correct answer here. Next, we will discuss question number 6. The fetal organ of placenta is. Here, the fetal organ of the placenta options: option A 4 by 5th, option B 1 by 5th, option C 2 by 5th, and option D 3 by 5th. Here, the placenta in fetal organ of placenta is a temporary organ during the pregnancy. The placenta is fetal organ that exchanges nutrients, gases, and waste between the maternal and fetal circulation. Placenta is a crucial for the normal development and survival of the baby in the womb. Mature placenta is 4 by 5th in this position, on average 22 centimeters in diameter and 2.5 thickness at the center, and also 500 grams weight approximately. Here, option A is the correct answer. Placenta organ of fetal organ of placenta is at 4 by 5th. Option A is the correct answer. Here we can see the placenta, fetal organ of placenta in this picture. Next, move on to question number 7. Hydatiform mole. Hydatiform mole is an abnormal condition affecting from the following options. Here, Hydatidiform mole. It is also called as molar pregnancy here. Hydatidiform also mole also called as molar pregnancy. Options, we will see the options here. Option A Korean, option B villi, option C amnion, and option D blastomere. Here, Hydatidiform mole is abnormal condition affecting Korean. Option A is the correct answer. A molar pregnancy is known as the Hydatidiform mole. Hydatidiform mole. The molar pregnancy is known as Hydatidiform mole. It is a rare complication of pregnancy characterized by the abnormal growth of the trophoblasts. The abnormal growth of the trophoblast, the cells that normally develop into the placenta, and complete molar pregnancy. It is a partially molar pregnancy. It will be happen a complete molar pregnancy or partial molar pregnancy. Here we can see the molar pregnant means pregnancy. In this cases, complete or partial it will be there. The Hydatidiform mole, molar pregnancy, we can see in this picture the center point of view. Molar pregnancy, this is the abnormal growth. Trophoblast, the abnormal growth of the trophoblast or fibroids also one of the cause. Okay friends, here Hydatidiform mole is abnormal condition affecting the Korean. Option A is the correct answer here. Next, move on to question number 8. Pap smear in pregnancy is a. Options means here in this question, what is pap smear pregnancy? In pregnancy, pap smear test. Options: option A contraindicated, option B not necessary, option C routine as a part of screening, and option D identify the anomalies of fetus. Here, the pap smear test is one of the pap test. Pap test looks for precancer cell changes on the cervix that might become cervical cancer if they are not treated appropriately. Doctor used the vaginal speculum to hold the vaginal wall apart and to see the cervix. A sample of cells from the cervix to be sent for the laboratory. This is one of the pap smear test, also called as pap test. It is a routine as a part of screening. Option C is the correct answer here. Here we can see the pap smear test through the vaginal speculum by using a vaginal speculum. One pap swab to be taken by the doctor. Here pap smear at pregnancy routine as a part of screening. Option C is the correct answer here. Next we will move on to question number 9. What is the normal position of uterus in the female body? Okay friends, what is the normal position of the uterus in females? We will see the options here. Option A, anteverted. Option B, anti-flexed. Option C, A and B, and option D, anti-extended. Here the anteverted, anti-flexed is the normal uterus positions. Here option A and B is the correct answer. Anteverted and anti-flexed in your uterus tilts forward at your cervix toward the abdomen. Anteverted uterus typically sits on top and slightly behind the bladder and front of the rectum. So these both are the normal positions of the uterus. Option A is and option B, anteverted and anti-flexed, is the correct answer here, the normal position of the uterus. In this picture we can see here anteverted uterus, the normal position of the uterus. The uterus is upper position and the uterus typically sits on the top and slightly behind the bladder, front of the rectum also we can see here. Next we will move on to question number 10. The 10th question. A multigravida mother has quickening at. A multigravida mother, when the quickening feels. Options. Option A, 16 to 18 weeks. Option B, 20 weeks. Option C, 6 weeks, and option D, none of the above. Here the multigravida mother, when a pregnant person starts to feel their baby's movement in their uterus or womb, feels like flutters, bubbles, or any tiny pulses, it will be happens around the 16 to 20 weeks of the pregnancy. But some people may feel it sooner or later. Not exactly the 20 weeks, it had to happens in around 16 to 20 weeks in pregnancy, but some people may feel sooner or later. Okay friends, option B is the correct answer. Multigravida mother has quickening feels at 20 weeks of the pregnancy. Next, move on to question number 11. At the end of the labor, the uterine weight is. Here what is the uterine weight at the end of the labor time? Options. Option A, 1200 grams. Option B, 900 grams. Option C, 400 grams, and option D, 450 grams. The weight approximately is 1000 grams, but here in this option related to 1000 grams approximately is option B, 900 grams. Here option B is the correct answer. The pregnant term uterus, not including the baby, placenta and amniotic fluid, not included, only the uterine, means uterus is the weight approximately 1000 grams. Uterine fundus is palpable at or near the level of the maternal umbilicus. Okay friends, here option B is the correct answer. 900 grams approximately is 1000 grams, but here in this option 900 is there, so option B is the correct answer. Next, move on to question number 12. BARR, Barr bodies, are not present in options. Option A, XX, option B, XY, option C, XSY, and option D, XO. Barr bodies can be found in biological samples such as hairs, buccal cells and blood. Since women have two X chromosomes, male typically have no Bohr bodies present since they have only one X chromosome here. Bohr bodies is absent in example case Turner syndrome. Here option D is the correct answer. Bohr bodies are not present in XO. Option D is the correct answer. Move on to question number 13. Which of the following is used in colposcopy? Not colonoscopy, friends. Here colposcopy. Colonoscopy is visible to examine the colon. So here colposcopy, not coloscopy. Here we will see the options here. Acetic fluid, option B. Providone, iodine, option C. Methylene blue, option D. None of the above. Here the colposcopy is a test to take a closer look at cervix to find any changes in the cell that are caused by the certain types of human papilloma virus HPV. In case we are not treated, it's turned into the cervical cancer cells. So that's why colposcopy done during the pregnancy. In this colposcopy used acetic fluid. Option A is the correct answer here. In the colposcopy, acetic fluid is used to look closer at the cervix for identify any cervical cancers and abnormal cells in the cervix. Next, move on to question number 14. Organ which is affected first in IUGR. IUGR we all are know, intrauterine growth retardation or restriction. We will see the options here. In this IUGR cases, which is affected from the following options organs. Option A liver, option B brain, option C skeleton and option D muscle. Here the IUGR means intrauterine growth retardation or restriction. The affected organ is brain. Approximately 80 to 85% of fetus identified as being IUGR small but healthy. But 10 to 15% cases chromosomal abnormalities or structural anomalies is there in these cases. Here in these cases IUGR cases we can see here the baby is premature or low ABGA score and lung diseases and also low brain development also we can see here. Option B is the correct answer. Organ which is affected in IUGR cases, option B brain is the correct answer. Let's move on to question number 15. Best contraceptive for 20 years nulliparous means the best contraceptive methods from the following at the age of 20 years nulliparous. Option A IUD intrauterine device, option B pills, option C condoms and option D foam tablets. The intrauterine device and the contraceptive implant should be offered routinely as safe and effective contraceptive options for nulliparous women and adolescents. The most best contraceptive method at the age of 20 years in nulliparous is pills. Option B is the correct answer here. Option B pills is the correct answer. The best contraceptive methods is pills here. Next move on to question number 16. Robot sign is found in options IUFD, option B abruptio placenta, option C placental previa, option D Hydatiform mole. Option A IUFD intrauterine fetal death is the correct answer. Robot sign. Fetal death in utero means fetal death in uterus. It is a rare sign caused by post-mortem blood degeneration. Usually we can see in 1 to 2 days after the death and may be seen in as soon as early in 12 hours of post IUFD. Intrauterine fetal death. Robot sign we can found in IUFD intrauterine fetal death cases. Here option A is the correct answer. Move on to question number 17. Which common pregnancy condition can occur during the third trimester? In this pregnancy, third trimester, the common condition We will see the options here. Option A, physiological anemia. Option B, respiratory acidosis. Option C, acne vulgaris. And option D, all of the above conditions. Here the common pregnancy condition occurred in the year of in the month of 7, 8, 9, third trimester. Here option A is the correct answer, physiological anemia. HB and hemocritic levels decreases during pregnancy even though RBC production increased by 20%. The plasma volume also increases, causing a dilution of RBCs. A HB level of pregnancy and naturally drop to 10.5 grams per deciliter, but it will be considered as a normal condition, not abnormal condition. It is also normal condition. Physiological anemia we can treat if it is decreased less than 9 or 8, means we can treat like blood transfusion. Here physiological anemia is the pregnancy condition at the third trimester. Option A is the correct answer. Next, move on to question number 18. Partograph was first devised by, not photograph, photograph. Partograph, also called as partogram. Partograph was first devised by options. Option A, Friedman. Option B, Dr. William Shaw. Option C, Dr. L. Madalier. Option D, none of the above. Here the first graphic assessment of progress of labor was designed by Friedman. Option A is the correct answer. Further improvement done by the Philpott and Castell. Here the partograph was first devised Friedman in the year of 1954. In this partograph, it is like a TPR chart. In this hospital we are seeing TPR chart and also ventilator chart. Like this is one of the type of chart. In this chart we can see the columns, some of the columns: hours of labor, normal ruptured membrane, rapid assessment of the pregnancy and vaginal bleeding, and etc. We can see the columns. I will show you. Here we can see the partograph. This is the partograph chart. During the assessment of labor, we can the graphic assessment of the progress of the labor we can monitor in this chart. Through this chart we can monitor. The partograph is first devised Friedman. Option A is the correct answer. Next, move on to question number 19. The 19th question is, short cord is then if the length of umbilical cord is less than how much? The short cord. Then if the length of the umbilical cord is less than how much? Options: option A 10 centimeters, option B 20 centimeters, option C 5 centimeters, and option D 35 centimeters or less. Here, if it is 35 centimeters or less in length is considered as short cord. Short umbilical cord occurs roughly 6% of pregnancy cases. It is risky condition because it can be affect the growth and development of the baby as well as outcome of pregnancy also risk. So here umbilical cord less than 35 centimeters or less is called as short cord. Here option D is the correct answer. 35 centimeters to less. 35 centimeters or less is the called as short cord. Next, move on to question number 20. The 20th question is, cervical canal length is the how much cervical canal length you are having? Options: option A 2 centimeters, option B 2.5 centimeters, option C 4 centimeters, and option D 3 centimeters. The cervical canal length of 3 centimeters measured between the 20 to 24 weeks of gestational age in preterm births, and cervical canal length is more than 4 centimeters measured with post-dated pregnancy and increased incidence of cesarean sections. Here cervical canal length is 2.5 centimeters is the correct answer, approximately, not exact. Next, move on to question number 21. The oral contraceptive pills need to be started on. Okay friends, Here, when we have to start oral contraceptive pills, we will see the options here. Option A, first day of menstruation. Option B, third day of menstruation. Option C, after menstruation. And option D, fifth day of menstruation. If you are start the combined pills on the date of first day of periods, you will be protected from pregnancy straight away. No back of contraceptive methods, no need to take. If you are started first day of menses, here option A is the correct answer. Oral contraceptive pills and combined pills we have to start in the first day of the menstrual cycle. Option A is the correct answer here. 22. Bluish surface veins are visible at. The blue colored veins is visible at the pregnancy time. Options: option A 4 weeks, option B 2 weeks, option C 6 weeks, and option D 8 weeks. The bluish or purple veins often starts to appear in the first trimester by at the week of 8 to 10 weeks. So here bluish or purple veins we can see in this 8 to 10 weeks. So here option D is the correct answer, which is when your body has started producing more blood to supply and more blood support to vagina and your baby. In these cases we can see the bluish color veins. Here we can see in this picture, not only in the abdomen, we can see in these legs also the bluish discoloration of the veins. Here option D is the correct answer. 8 weeks of time, not only 8 weeks, it will be 8 to 10 weeks of time we can see bluish surface of veins in body. Next, move on to question number 23. Myometrial hypertrophy causes. Okay friends, increasing the myometrial hypertrophy causes. Options: option A, distension of the abdomen, option B, distension of the bones, option C, distension of the muscles, and option D, distension of the heart chambers. In this question only is there myometrial hypertrophy. Myometrium means in the heart. So distension of the heart chambers is the correct answer, option D. But what is meaning of hypertrophy? Hypertrophy means increasing the size of cell or increasing the size of the tissue. Here myometrial hypertrophy means increasing the size or cell, means the size of the cell or size of the tissue, increasing the overgrowth of the walls will be there in the heart, distension of the heart. Here the correct answer, option D. Myometrial hypertrophy, increased thickness of myometrium, and due to the hypertrophy of the muscles of cells, causes are uterine fibroids and adenomyosis. Here you can see the fibroids in the uterus. In this picture fibroids is there. The common fibroids are uterine fibroids. In cases 8 in 10 women by the age of 30 to 50 cases. Okay friends, in the age of 30 to 50 age, we can see the 8 in every 10 women, we can see these cases myometrial hypertrophy. Here option D is the correct answer. Distension of the heart chambers is cause of increased myometrial hypertrophy. Next, move on to question number 24. The total average iron requirement during the pregnancy. Here, what is the iron requirement during the pregnancy average? Options: option A 2000 grams, option B 1500 grams, and option C 1800 grams, and option D 1000 grams. Here, recommended dietary allowance of diet during the pregnancy, the iron is approximately 1000 mg. Okay friends, here option D is the correct answer. The source: food like meat, chicken, fish, egg, and dried beans, and also grains. So the iron is requirement of pregnancy average is 1000 grams. Option D is the correct answer. See the 25th question. Which of the following grip also known as the umbilical grip? Okay friends, which of the grip is known as umbilical grip? We will see the options. Option A Pavlik grips, option B lateral grip, and option C fundal grip, and option D pelvic grip. Here umbilical grip also called as umbilical grip is also called as lateral grip. Option B is the correct answer. Not only lateral grip, umbilical grip also called as lateral grip, and also second Leopold's maneuver also is one of the name of the umbilical grip. First, the right hand remains steady on one side of the abdomen while the left hand explores the right side of the woman's uterus. Here also the examiner must face towards the patient. Through this process we can feel the lateral grip. So here we can see in this picture the assessment, antenatal assessment of the pregnant woman, the lateral grip. We can feel the lateral grip or umbilical grip. Here the grip also called as umbilical grip, also called as lateral grip or Leopold maneuver. So here option B is the correct answer. Next we will move on to question number 26. Most commonly single umbilical artery is seen in. Actually in umbilical cord we can see the two arteries, one vein, but the single umbilical artery seen in these cases. Options: option A abruptio placenta, option B placenta previa, option C multiple birth, and option D battledore placenta. Single umbilical artery most common in multiple pregnancies. Prenatal ultrasound, prenatal ultrasonography evaluation can be done. Through the ultrasonography we can identify the umbilical artery, single umbilical artery. The ultrasound should be done during the second and third trimester of pregnancy. In these cases second trimester ultrasonography was done, yet 27 weeks showed the single umbilical artery with no other associated with anomalies. Here the commonly single umbilical artery can seen in multiple birth. Here we can see in this picture normal cord and single umbilical cord. In the first picture this is the normal umbilical cord, one vein and two arteries, but in single umbilical artery we can see here one artery and one umbilical vein. So here option C multiple birth is the correct answer. Next move on to question number 27. Deficiency of thyroxine in adult leads to condition is called as. The deficiency of thyroxine is leads to which condition? The condition is called as. Options: option A tetany, option B myxoedema, option C Graves disease, and option D cretinism. Here myxoedema is another term for the severely advanced hypothyroidism. It is a condition that occurs when your body doesn't produce enough thyroid hormone. The thyroid gland releases hormone that helps body regulate energy and control a variety of functions. The thyroid gland is situated in the right at the front of neck. Thyroid gland is small and that sits right at the front of the neck. So the deficiency of thyroxine in adult leads to condition is myxoedema. Option B is the correct answer, myxoedema. Next we move on to question number 28. Clinical features of Hydatiform mole or molar pregnancy. Options: option A show strong appearance in ultrasound, option B absence of fetal part and LH-FSH, option C elevated level of HCG, and option D all of the above. Here in this Hydatiform mole we can see the show strong appearance in ultrasound, absence of the fetal part of LH and FSH, elevated level of HCG we can see in these cases. The clinical manifestations of the Hydatiform mole: severe nausea, vomitings and vaginal bleeding during the first 3 months of pregnancy, and symptoms like hypothyroidism and includes the heat intolerance, loose stools and rapid heart rate, and also restlessness, trembling of the hands and feet, and also unexplained weight loss also we can see in this Hydatidiform mole cases or molar pregnancy cases. Here all of the following is the correct answer. 3 options. All of the above is the correct answer, option D. Next, move on to question number 29. 29th question in this video. When teaching a client who is planning a get pregnant about the need to increase folic acid, which food can nurse suggest? Options: option A apple, option B yogurt, option C spinach, and option D chicken. In these cases, the folic acid, increase the folic acid in our body, or the pregnant women need to increase folic acid means we will encourage, as a nurse we will suggest option C spinach. Green and green leafy vegetables are excellent source of folic acid. For example, the folic acid sources spinach, broccoli, and also sprouts, avocados, and asparagus. These are the excellent sources for the folic acid. Next, good sources for the folic acid also. Fortified cereals are great sources of the folic acid. Here option C is the correct answer. The increased folic acid in our body are pregnant women, we are suggesting to spinach. Option C is the correct answer here. Next, move on to question number 30. This is the last question in this video. Next we will continue 31st to further questions. The 30th question in this video. Fundus reaches to the zipisternum at options: option A 40 weeks, option B 36 weeks, and option C 26 weeks, option D 24 weeks. At the 36 to 38 weeks, uterine fundus is at about the level of the zipisternum. So here option B is the correct answer. Fundus reaches to the zipisternum at the 36 weeks is the correct answer. Not exactly 36 weeks, but approximately 36 to 38 weeks is the correct answer. Here in this option there is no 36 to 38. So here option B 36 is the correct answer. Option B. We can see here in this picture the fundus reaches to the zipisternum at the 36 to 38 weeks of the pregnancy. The uterine fundus reaches at zipisternum at the 36 to 38 weeks of pregnancy. We can see here in this 12 weeks, 14 to 16 weeks, 20 weeks, 24 weeks, 26 weeks, 32 weeks, and 36 to 38 weeks. Here option B is the correct answer, 36 weeks. Next we will continue further questions in part 2 video. Stay tuned friends. Thank you for watching my video. Please subscribe my channel, click on the bell icon for further notification. Keep watching.